Shall I start,
Yes.
madam?
Yes, sir. Yes, sir. Please.
Today I am going to deal about the introduction about the mental health and the prevalence rate pertaining to the mental illness and Ayurvedic understanding about the manas and what are the illnesses which are comes under the manovikara. Okay, today is the World Mental Health Day. If you see the overall prevalence as well as the fact pertaining to the mental illness, the Mental Health Day mainly deals about the awareness towards the mental issues and the person who already suffering with the mental illness, better to give the support for them and how to come out from that illness. That is the important part of the today's mental health awareness program and mental health day. The word mental health days, the theme of the year 2022, the make mental health and well-being for all a global priority. Every year, 10th October is celebrated as the World Mental Health Day. With this background, we'll come to the prevalence rate of the mental health disorders. If you see the overall the scenario of the world as well as the globe, you go to the urban metro areas, around 13.5% of the people suffering with the mental disorders. Not only in the urban metro areas, in the urban areas also around 4.3% of the people suffering with the mental illness. Around 6.9% of the rural area individuals suffer with the mental illness. Around the 7.1% of the females are suffering with the mental illness, and male 7.5% of the individuals suffering with the mental illness. If you come to the understanding about the Ayu. Okay, Ayu is the component of the Sattva Atma Shariram Cha Trayameva, the combination of the Sharira, Indriya, Manas as well as Atma. It is mentioned in the Charaka Samhita Sutrasthana first chapter. The total, the Sharira and Ayu is the component of the Indriya, Manas as well as Atma. Okay, what is the health? If we go scan the literature, it may be from the contemporary, the medicine, or from the Ayurvedic, the literature. The text says the person when to consider to be the healthy individuals. There are Sushruta Samhita Sutrasthana 15th chapter. He mentioned that the individual who consider to be an aswastha. There he given the separate set of the entities. The first one is Samadosha Samagnischa Samadhatu Malakriyaha Prasanna Atma Indriya Manaha Swastha Ityabhidiyate. The same definition is depicted in the contemporary medicine. The health is the complete state of physical, mental, social well-being, not only merely the absence of the disease or infirmity. The same thing, the complete, the samavastha of the dosha, the jatragni of the individuals, and the proper functioning of the dosha dhatumala with prasanna mana. That is considered to be the swastha state of the individual. Otherwise, it is the disease state. Whenever we go through the different the aspects of the health, okay, when the person is having the complete the state of the health, that depends on the multiple factors. The first factor is the food, whatever the food and nature of the food which is consumed by the individuals. The even the food depends on the prakriti of the individuals, and even the desha, and whatever the viharas activities which are done by the individuals, and the mental state of the individuals. The manas also plays an important role, and desha, the habitat of the individuals, and kala is also having the influence on the health of the individuals. We can analyze all these things according to the follow-up of the dinacharya and the ritucharya and impact of these on the individuals who suffers with the different set of the illness. Today, mainly I am dealing with the mental health. What is the mental health? Mental health includes the state of the emotion of the individuals and the psychological, the well-being and the social well-being. Not only this, if anybody comes to us with a different the clinical the presentations, in that time we interact with the patient in terms of the Trivida Pariksha, that is Darshana, Sparshana, Prashanaiha Parikshata cha Rogina. That time also we can analyze, especially in the practice of the Manasika Vikara. We can analyze because the face is the index of the mind. By individuals, the facial expression and even the thinking, how the individuals are reacting to the particular the situation and doctor, and how the individuals are having the feeling about the illness, and even the act, the immediate the action towards the questionnaires. That is very much understood by the questionnaire in individuals. And not only these, if you come across with this, it doesn't serve the purpose. We have the different the stress factors in the day-to-day the life, even it may be related to the particular the occupation. Okay, we are the doctors, we come across with the different the patient may having the some of the stressor factor, how to overcome from that particular the stress. And not only that, and we have the different choices in the practice and even the life, how to overcome from that particular the situation. That also comes under the mental health of the individuals, because most of the time without considering their situation and we are there in a particular the stress factor, immediately we exhibit some or the other the presentation. But if it is continued for all the situations, then only we consider it as the individual who suffers with the mental illness or the psychiatric problem. Whenever we analyze the different the factors pertaining to their mental health, the mental health is not only related to their particular age group. The mental health is there from birth to the adolescent and even the old age also. The keeping the strong mental health is the evidence for the one of the component of the health. Then, after considering all these factors related to the mental health, when to consider the individual who suffers with the mental illness. The first and the foremost, the person who is having the changes in their the thinking, behavior, or the feeling, any one component among these, or the combination of the thinking capacity, the feeling, and the behavioral disturbance of the individuals. And the most of the time the mental illness are related to the difficulty in terms of the problems, that is the functioning with the occupational the individuals or the social the working individuals, and with the adjustment with the work or the family activities, that plays an important role to name the individual as the mental the illness. You come to the Ayurvedic perspective about the understanding about the amanas. In the literature, the Bruhatrais may have the different the concept related to the manas. The first, what is exact understanding about the amanas? Here he says, Chadga Kalpadruma given the Manyate, Jnayate, Buddhyate Anena iti manaha. Manas is the media for the perception about the different the knowledges. The next, the manas is comes to be anyone the tantraka and the preraka of the individuals. Okay, next we have the mono vishayas. If you go with the literature, that too from the Charaka Sutrasthana, there he told about in the Mano Vishaya, given the explanation pertaining to the Mano Vishaya, Mano Karma, and even the Mano Vishaya. Here, the Manastu Chintyam Artaha, whatever the thinking capacity we are having according to the different the situations. For example, I am dealing with the on this online platform. If I ask some questions to you, what is the response from you? That is assessed by the chintya or the thought process of the individuals. Not only this, in the practice also, the person who suffers with the monovikaras, they may be hampered with the some of the monovishas. You need to identify that particular the monovishya which is hampered in individuals. In detail about the monovishayas, the Charaka even told in the Sharirasthana first chapter, that is one the first and the foremost component is again the chintya. Not only these, chintyam vicharyam uhyam deyam sankalpamevacha yavat kinchit manasodneyam tat sarvam arthasanyakam. The chintana is the first. The next there will be the sankalpa, the determination of the, and even the uhya. We need to hypothesize some of the things. The hypothesis regarding the analysis of the patient, and even the presentation related to the patient, that may be hampered in individuals. Not only these, even the karmas are which are exhibited by the manas in the form of the indriya nigraha Okay, manas is considered to be the Ubhayendriya. Almost all the functions of the manas which are governed by the manas, that is Indriya Abhinigraha, Karma Manasa, Swasya Nigraha. Not only a control of the Panchendriyas, manas is also having the Nigrahana in there, and even the hampered the functions of the manas, that is possible. Person loses their the mano nigraha, then also there is a possibility of the illness. Then what is the swastha mana? Okay, whenever we deal with the different the manasika vikaras, first and the foremost consideration related to the the manas is functioning properly, or is there any abnormalities pertaining to the mana karma of the individuals. If you want to assess the person is having the swastha mana, the first thing should be the controlling of the manas from the ahitebhya artyebhyo manonigraha. The controlling of the manas from the ahita arthas. The best example nowadays we are using the electronic the medias. The most commonly all of us from the even the 1 year baby to up to the young individuals, they are used most of the time the addicted to the social media. The commonly used the social media is the cell phone which is used. On and average, the individuals are spending their time in the social media by using their mobile phone. Average on and average the 1 to 2 hours. But if you are using for the proper the purpose for your the occupation related, or the knowledge purpose, you are using the media, that is well and good. But sometimes we are not having the control over that particular the cell phone or the usage of the social media. That itself acts as the aswastha for the prolonged run. That's why the aswastha mana exhibited the initially in the form of the minor form of the psychiatric illnesses, that is also identified in their text in their sutrasthana. He told about the few of the causes for the mano aswasthata in the form of the manoroga apyukte sarve prajnaparadajaha. Okay, almost all we are conducting one or the other or indulging in the intellectual the errors in the under the heading of the prajnaparada, but try to minimize. Okay, at what time you want the particular the thing, as well as the usage of the social media or any other the things according to your need, then only one should use. Otherwise the excessive usage of any of the things, that itself acts as the prajnaparada. This is one example. Like that we have the committing the prajnaparada in the form of the vega dharana, and we have the committing the prajnaparada the ati vyayama. Like that many other the examples which are told in the classics. The Sushruta also identified. Okay, we have the how the Sharirika Vikaras are classified in their text. We have the classification of the Manovikaras. The Manasas too. The Manas is exhibiting the different the things, the Vikaras in the form of the Kama, Krodha. You can see about the different the psychological disturbance in this the picture. Tayor Vikaraha. How we have the manas sharirika vikaras, even the manasika vikara in the form kama, krodha, lobha, moha, irsha, mana, mada, shoka, chinta, udvega, chittodvega, bhaya, harshadayaha. The person, almost all of us, one or the other day suffered with these illnesses in the form of the kama, the anger. The most of the time we come across the akrodha, the exhibition of the psychological disturbance. But the exhibition of these symptoms for one or the for single day never considered as the disease. But if it is the repeated the changes in the disturbance of the individuals, it may be atikrodha or the atishoka, or in the form of the udvega with the different the physical symptoms. Then only we name it as the a disease. Otherwise we can control from the mano nigrahana. Next, okay, we come across the a few of the cases in our practice. Okay, this is the case which is having the presentations of the apasmara. If you see the individuals, the bibhatsa chesta, and even the vikrutis related to you see the definition of the apasmara, there will be a loss of the smriti, smriti rapagamam praho Bibhatsa Chesta. We see the eye, the gauging of the eye in this image, and the total the presentation related to the apasmara in this image. Okay, this is the case already the diagnosed with the apasmara by the earlier the hospitals, and he was on the anti the epileptic drugs. The initially he was on two drugs. After approaching to me, he is the patient who is very near to me, and he come to me after developing almost all the adverse effects, and he's used to have the drowsiness throughout the day, and most of the time unable to walk the properly. The work is hampered. He just started with a single drug. Okay, this was the first case of me given with the only Ayurvedic medicine, that is the Tantu Pashana. Only a single drug, so almost having the changes in the presentation. Initially, this is the video which is taken before the treatment, but now almost the episode is zero from last the 3 months. He's leading very good life, and he's doing all his the work. Okay, whenever we come across the manovikaras, okay, Ayurveda having the different the principles, the basic principle to analyze about the knowledge about the disease as well as the medicine in the form of Hetu Linga Aushadha Jnanam Swastha Atura Parayanam. You need to analyze the Karana of the Avadi, the Nidana or Hetu refers to the Karana of the particular illness. But most of us are not considering about this. For manifestation of the different illness, the first and the foremost Nidana is the identifying the Vyadi Karana, then analyze about the different the Lakshanas, then plan for the treatment of the individuals. We go through the different the psychiatric the text. We have the different the causes for the mental the illness. I'm not discussing all the causes. The most common causes will be the lack of the education, and nowadays almost all the individuals are having the education and almost all fast their degrees, but the poor employment. If you done the degree but there is no satisfaction about the your employment as well as your the economic the crisis, then also the person may start thinking overthinking about their job as well as the occupation and about his degree and his occupation. Then also there is a chances of the psychiatric illness. And next will be the very common the problem with the family and the marital factors. Most of the time the family, there is a chance of the familial tendency of the psychiatric illness. If mother or father suffering with the psychiatric illness, there is again chance of the suffering of the some of the psychiatric illness based on the genetic factor in their family. And sometimes because of the burden from their family members and repeated the exposure to the stress, that also leads to the psychological disturbance. One day the repeated exposure to the stress factor also leading to the disturbance in individuals. The next, nowadays that very common in the young the individuals or youngsters, the use of the substances. Okay, initially they start with using their drugs, especially the psychoactive substance. Under the heading of the psychiatric illness, the one classification we have psychoactive substance abuse disorders. The most common drug which is used in the society initially for the enjoyment purpose, the common drug is the alcohol. The alcohol is one such drug. Initially it gives the enjoyment, but later it start eating over almost all the system. Initially start acting over the central nervous system. That's why in the Sharir, the Charangadara Samhita, they are given their definition. The Buddhim Lompati Yadravyam Madakari Taduchate. Whatever the psychoactive substances we are having at present, that is having the tendency to act on our the buddhi and do the buddhi brahmana. The best example is Madhyam Suradikam. Person who is having the habit of excessive usage. You can see how the individuals after consuming the madhya they start acting. The disturbance in the psych factor of the individuals, then abnormal the thinking. It may be in terms of the chesta, buddhi. There are different vibramas which are going to happen after the consumption of the madhya. The common lakshanas which are seen in individuals who suffers with the manovikrutis. Okay, almost all of us experience, especially this is possible in the students before the exams. One example I am giving, this is possible with all the individuals according to their the occupation and the profession. Most of us will experience the nervousness or irritability. If you have the stress factor with you, suddenly there will be irritability, and next will be in the form of the abnormal the body aches. If you try to analyze the what is the history or the tender point of the patient, most of the time it is vague in nature, and patient experience the fatigue without the much of the activities. There will be the restlessness or the fatigue. And whenever you ask the patient about what are you doing and what you want to do in the future, they don't have aim at all, and whatever the activities they want to do during that particular the situation, there'll be a mistakes which is done by the individuals. Not only these, the same thing which are told, if enable do the ati chinta, they may exhibit with the attention the presentation of the attention, and sometimes the individual may have the phobia or the fear, and even the repeated worry about the same aspect, and the alpa nidrata, and even the history of the patient, then go for the analysis of the dosha and the treatment protocol of the individuals. If you go with the psychiatry, the textbook of the medicine, we have the very common the disorders which are seen in the psychiatric practice. The very common is the depression. This is a very common cause. Okay, most of the in day-to-day practice, if you see the newspaper, one or the other reason the person may committed for the suicide, or they are standing up in their presentation of their depression, they committed the suicide mainly because of the illness. They initially they met with the strong the psychological disturbance, and they won't get most of the time the treatment out of that, and they unable to come out that particular situation by the psychiatric the practice or the family members. One day definitely they will go for the depression. That's why the depression is the leading cause for the death among the psychiatric illness. Then second most the disorders is the panic disorders. The third one is the schizophrenia. To be the major form of the psychiatric illness, the schizophrenia and the bipolar mood disorders, the panic disorder, the phobic disorders comes to be the minor form of the psychiatric illness. The one more is the post-traumatic stress disorder. Okay, not only these, okay, in our practice we come across this image, definitely we can appreciate the Chakshashur Akulata, person unable to concentrate in that particular the work or situation, and we call it as the pickle the mindedness, and there is no proper the eye contact. Okay, whenever we are dealing with the Manovikara patients, we need to analyze the gauge or the vikrutis related to the face. The one is the Chakshashur Akulata, and next will be the lack of the coordination with the patient and the doctor. Like that we have the depressive, the illness, and one more is the very common that in the adolescent females, the eating disorders. The next one is obsessive compulsive the disorder. Okay, under the heading of this, we have the repeated the washing as well as the checking. Most of the individuals are having. If they give somebody to the money to the individuals to count, there's a repeated checking about the how many the counts they are having. Next will be the sleep disorders. It may be related to the sleep awakening. These are the very common the disorders which are seen in the practice. The next, before starting the analysis of the patient, after identifying the etiological factor and some of the disturbance and presentations of the monovikritis, one should even know about what is the exact relation between the Sharirika as well as the Manasika Vikara. It is explained in the Charaka Vimanasthana, a sixth chapter. There Charaka says, Teja Vikaraha Paraspara Anuvartamanaha Kadachit Anubadhanti Kamadayo Jwaradayascha. Here the Paraspara Anuvartamana refers to there is an impact of the psychological disturbance on the sharirika doshas. This is one pattern of the presentation in the form of the physical illness leading to the mental the disturbance, or the vice versa. Sometimes the mental illness even having the influence to cause the sharirika dosha drusti. That is also told in the Charaka Chikitsa third chapter in the Jora Chikitsa Adhyaya. The kama, shoka and bhaya. Naturally there will be the vata prakopa. Next will be the krodha, krodha for the prolonged time. Then there will be a vikruti in the form of the pitta dusti. That is possible. The best example is given the jwara is big mainly because of the arudra kopa leading to the sharirika the vikrutis. If you analyze this much, that never serve the purpose. Okay, before planning the treatment of the any of the disease, the examination of the patient is very important. Okay, that's why the examination of the manovikruti, okay, whatever the mental status examination we have depicted from the contemporary medicine, the same thing which is told in the Charaka Nidanasthana 7th chapter while explaining the Unmada Nidana Adhyaya. If you see the definition of the Unmada, there he says Unmadam Punaha Mano Buddhi Sanyajnana Smruti Bhakti Sheela Chesta Achara Brahmam Vidyat. That is the understanding about the total the mental status examination of the individuals. The one example is that if anybody is having the Vibrama, the Buddhi Vibrama, first the Mano Vibrama in the form of the Achinta. One should think about the according to the situation, but Tatra Chinta Vibramat Chintan Arthan Na Chintayate Achintyanam Chintayate. The best example. Okay, at present the student may be having the exams, but we never think about our study part. We are always thinking about the results, but that never, so that is comes to be the abnormality. Repeatedly if you are not putting the effort to prepare for the exams, suddenly you are worrying about your the results without the proper the dedication and the preparation towards the exam. That is achintyanam chintayate. Not only this, you come to the patient aspect also. Most of the time patient thinks, okay, we come across many of such patients, if they are having their chest pain, for their chest pain, but patient if they are having the milder form of their chest pain, they always think about their bigger diseases. In the form if they have the light headache also, they think about most of the time I may be having the problem related to the ischemic heart disorder. That is considered to be the abnormality towards the chinta. The next we have the buddhi, that is buddhi vibramastu nityam anityameti. Person never think about the present the situation, they always think about the abnormal the situations. The same thing is told in the form of the chesta vikrutis, in the form the behavior of the patient. If we go to the chesta vibrama, there he told anuchita chesto bhavati. The example he given, one example is anuchita chesta. The best example if you analyzing the any patient of their psychological disturbance, if they come to your OPD and just observe their face, the face of their patient, and try to look the facial expression as well as the eye contact of their patient. Most of the time, the patient in the acute phase of their psychological disturbance, there will be the changes in the behavior of their patient. They feel very difficulty to maintain the proper gaze or the eye to eye contact with the doctor. We call it as the rapport. And even the psychomotor the activity, they hesitate. Most of the time they feel difficulty to interact with the doctor. If you are in a crowd, they are unable to proper history like that. Even they have the abnormal the bodily movements in the form of the tics chorea for movement. If somebody without any reason they start doing some of the abnormal activities, that is also possible. And even The problem pertaining to the speech. Most of the time this happens. Okay, aspasta vachanam, or the monotonous the speech, or the person always want to give the single word answers. Okay, if you ask the patient why you came to the hospital, most of the time patient, I'm just came for the consultation, but never they want to explain about the treat this the presentations. Okay, after analyzing or after giving some of the hints from you, then they will start talking with you. But most of the time, they are unable to talk even properly. Okay, always they will have they'll reduce the talkativeness, and most of the time they feel alone. And whenever you are alone, the time only they want to talk. The next, even the quantity of their speech that is also lost, and even the mood. We have the different other factors of the assessment in the form of the Shila Viprama, Achara Viprama. Okay, all these components are the examination of their mental status examination. The just an example of the Achara Viprama. The Achara refers to here the Shastra Shiksha Kruto Vyavaharaha. One example, every day you need to respect your the teachers and God as well as your parents. But one day the person who suffers with a psychiatric illness, they start telling themselves, I am the God, I don't want to worship anybody, I don't have anyone to worship, like that the patient. The just example there he given the Shila Vibramastu Ashauchat acharati. The just achara viprama in the form of the ashaucha. Person always. The lack of the personal hygiene. Okay, most of the person they roam here and there, the roadside without the proper grooming or the dress sense. That itself acts as the achara viprama. Okay, like that we have the assessment factors under the heading of the Unmada definition itself. Next, after analyzing these, how to approach to the cases of the mano, the roga, after identifying the cause or karana of the avadi, and after analyzing the lakshana, you need to go for the diagnosis of the illness. It may be in the form of the minor the psychiatric ailments, or in the form of the unmada, apasmara, madatya, or the state of the mada. After that, text says प्रशाम्यतौषधैः पूर्वो दैवयुक्तिव्यपाश्रयः मनसो ज्ञानविज्ञानै धैर्यस्मृतिसमाधिभिः. The combination of the daiva in the form of the mantra aushada and the swasthayana, and the combination of the different aushada and the ahara in the form of the yukti vyapashraya. And the last one is the sattva vajaya. Whenever we are come across the cases of the monovikrutis, according to me, the first is the sattva vajaya. Then go for the planning of the yukti vyapashraya. Then even the sattva vajaya also, sorry, daiva vyapashraya also plays an very important. The together application of the sattva vajaya, yukti vyapashraya, and Daivapash is the very important treatment protocol in case of the Manovikrutis. Not only these, even the Ashtanga they also identified in the form of Dhi Dhairya Atmadi Vijnanam Mano Doshaushadam Param. If you analyze the Nidana aspect of the Manovikritis, the person will have one or the other the strong psychological disturb which exhibited in the form of their different the Vata Pitta or the Kapha Vikrutis. Then the person will have the presentations in the form of the different the physical the presentations. For that, sometimes you need to go with the sattva vajaya in the form of the dairya, and one need to do the atmavalokana, and even shastra jnana also, the implementing of the shastra jnana in a psychological patients. The best example and commonly used the treatment protocol that to the Yukti Vyapashra in case of the psychiatric problem is the Medhya Rasayana. Go to the Charaka's understanding about the Medhya Rasayana. He highlighted about the Chaturvida Medhya Rasayanas, that is Manduka Parani is considered to be an best. The next, the Shanka Pushpi. The combination of these drugs in the form of the either the Swarasa or the Kshirapaka, or even nowadays we can do the modulations of these drugs. It is not only controls the manovikrutis, it gives Ayu Pradhanya, Amaya Nasanani. Almost all the other Rasayana benefit also will get out of this, the Medya Rasayana. Okay, before the manifestation of the illness, one, the Ayurveda deals with the swasthasya swastha rakshana. Okay, before the manifestation of the illness, the psychiatric illness, one should control the manas from the ahita artha, the preventive, the treatment in case of the mental health. Okay, one should always himself responsible for his the happiness and the miseries. Always one should have the strong control over his the manas. For that, always go for the following of the sadhrutta achara, the rasayana, and the taking of the different the the food which is having the sattva guna bahulata. Okay, nowadays, okay, given the examples of the chest pain, a person is having the monovikrutis for the prolonged time. It may even land up with the major the physical illness. The best example is the Rudroga. If you see the analysis of the Nidana aspect of the Rudroga, there he told Pariharya Visheshana Manaso Dukkha Hetavaha. A person is having the prolonged exposure about the mental the factor suffer with the major form of the physical illness also. And whenever you go through the earlier references from the Veda as well as the Gita, whatever the food were consumed by us, that also influence our the mind. That's why in Gita it is mentioned that Ahara Shuddhau Shattva Shuddhihi. The amount of the food which is consumed by us and nature of the food that is also having the tendency on the manas, the like that if you take their food, we have the different methods to consume their food. The one is tanmana bunjita. If you doesn't take their food in the relaxed manner, if you are there in the avastha of the anxiety or in the form of udvega, kebaya, or the krodha, definitely it causes the disturbance in the individual's mental health. Okay, finally, not only these, we have the following of the different the Achara Rasayana. Okay, under the heading of Achara Rasayana, most of the things are covered for the maintenance of the mental health of the individuals. That is, the first one is Satyavadina Akrodam. Person always have the truthfulness towards his activities, and whenever you want to talk, better to the truth about the fact. Next, the fear from the anger and abstaining from the madhya, that is niruttam madhya maitunat, and person always should be the non-violent and the relaxed position and the soft spoken and engaged in the meditation and the cleanliness, and always worship the god as well as go brahmana. Not only these, a balanced diet, and even person should behave according to their situations and always have the positive mind and always respect towards the holy books. Okay, after analyzing all the aspects related to the mental health, we have few of the clinical the studies which are done in our hospital from last the 6 years. We will discuss about the few of the cases. The first case, a boy aged about 27 years, not a known case of diabetes mellitus and hypertension, was apparently normal 1.5 years back, gradually started developing the abdominal pain in the umbilical region, chest tightness, difficulty in breathing, irritation in their throat, which is associated with the reduced sleep, and tremors in both the hands. For this, he consulted doctor at Hubli and even the Karwar. This is the patient from Karwar. Earlier, he hospitalized and done few of the investigations. The west abdomen endoscopy all are within the normal limit. Then he came to us and he got admitted and Baspashveda Nasya Karma with the Brahmi. Kruta, the Shiropitchu with the Brahmi Kruta. Okay, after analyzing the history and the diagnosis of the individuals, okay, this is the pure case related to the Chittodvega. Again, you need to plan the drug which is having the property of the media. The Brahmi comes to be an best drug which is having the again media property. You can use in the form of the Anasya or even the Shamana Snihapana. Like that, we have other the medicines, the Shamana medicines, the alert capsule. This is the main ingredient. Jyotishmati Tala is the main ingredient, and the Saraswata Arista 15 ml twice a day after food. Patient also having the Vikrut is related to the Annava Shrotas in the form of the Udara Shula. The Sutta Sekar Rasa was given to the patient. Patient got the 80% improvement after the 8 days of their treatment. Okay, one more. Okay, most of the time this happens in our practice. The patient, okay, most of the time the patient starts with the multiple the somatic complaints that also told in their text, but you need to analyze the mental status of their patient, and you need to have the evidences pertaining to the physical presentation. Okay, this is the case presented with the multiple the somatic complaint in the form of the a burning sensation in their chest and epigastric region, which is associated with the reduced sleep, purish like sensation, abdominal pain, multiple joint pain, and even the tingling sensation in the both lower as well as upper limb, irritation in the throat. For that, he almost I was the 10th doctor for him. If you analyze the history and earlier the past history about the illness, and even few of the investigations also gives the a clue towards the diagnosis about the illness. Different doctors has given the different treatment, and finally okay, somebody diagnosed it as the vital, or somebody diagnosed the case of the orthopedic and the neurology. Finally he came to me. Just they given with their the management. Okay, just analyze the patient history and given few of the medication. After analyzing the disease, we finally concluded with the Gadodvega. These that refers to the Vina Vadim Vadishankam Gadodvegamiti Iritaha. Okay, this is the disease explanation which is mentioned in the Vaishyaja Ratnavali. Some of the individuals already having the preoccupied idea about the disease. This is commonly happens with the females. Someday they come across the different the stress factors. They will start exhibiting some or the other the mental the ailments. Okay, this is the case purely treated from the psychiatric aspect initially, followed with the Sarvanga Benga and Baspashveda, the capsule alert and tablet mentat, one tablet twice a day after food. Patient got 80% improvement after 7 days of the medications and continued the medication for the 1.5 years. The patient was all right. Okay, now he is doing all his the activities. Okay, one more, the major form of the psychiatric illness which are explained in the classics, the Unmada. A boy aged about the 24 years, not a known case of diabetes mellitus and hypertension, was apparently normal till his PUC. Then he started developing the sudden, if you ask the family members ask something to the individuals, the sudden anger without any the reason, and increase the talkativeness and even the physical activities, and associated with the repeated the washing of the hands. Initially consulted a doctor at the Hubli. They are given some of the mood stabilizers and even the antipsychotic drugs. Even though after consumption of those the medications, patient never responded for the the drug. Finally, he came to us, and the Shodhana is planned in this patient. Okay, the patient who suffers with the major psychiatric illness, it is very difficult to withdraw the drugs initially, but the patient was willing to do the withdrawing of the drugs, and he was not in the acute the presentations of the illness. We immediately planned for the Ashodhana in him, that initially planned with the Deepana Pachana by the Chitrakadivati, okay, 2 tablets thrice a day or before food, and Snehapana with the Kalyanaka Gruta till the Samyak Snigdha Lakshana, then given with the Virechana, then followed the Samsarjana Krama. After the 5 days of the Samsarjana, the patient given with the capsule, the Breva ball, the Smriti Sagar Rasa. If you see the Palashruti of the Smriti Sagar Rasa, it is mainly indicated in, it is mainly having the Vachasvarasa and the Jyotishmati Taila mainly acts as the Medhya, and we can prescribe not only in the Unmada Apasmara where the Achitta with Udvega or patient got 80% of the relief after the whole the treatment. Now patient without any of the drugs, he is leading the very good the life. And next the one more the case of the Apasmara. Okay, she is aged about 20 years. She initially start took taken their treatment in some of the hospitals. The patient not responded for the any of the medications. The seizure was continue. Okay, she even took medication till the 2019. After that, she came to us and she having the presentation pertaining to the Apasmara. Okay, these are the earlier reports of the patient. Okay, initially consulted at Danapoya, the medical hospital, and they took the EEG. Okay, that is having the some of the changes, and finally diagnosed with the generalized tonic-clonic seizure, and patient was given with the anti the epileptic drugs tablet levacetam, apizime and axona. Okay, after taking all these the medications, patient start getting the cramps in their limbs and even the generalized body ache and weight gain. After that they came to us because whenever you are analyzing about the psychiatric patients, most of the patients were taken their treatment with the psychiatrist, and most of their psychiatric drugs are having the adverse effect, especially the antipsychotics as well as the some of the anti-epileptic drugs causes the disturbance in the renal profile and causes the weight gain in individuals and even the muscle cramps. Okay, we withdrawn all these drugs, and the one bad thing happened with this patient. Whenever she got admitted to our hospital, we started with the Nasyakarma with the Brahmi Gruta and Sarvanga Banga the with the Kshirabala Taila. This was the initial the treatment protocol which is followed, but then second sitting we planned for the Ashodhana in this patient. During the Sneha Pana, okay, we planned the Sneha Pana with the Kalyanaka Gruta in this patient. The patient suddenly developed with the acute the episode of the Apasmara. That is managed with our medicine only, and she almost withdrawn all the drugs. She is leading the very good life. And next the one more, okay, I already told the some of the important the causes for the psychiatric illness. The very common cause is nowadays that in the youth is the madhya. Okay, here a case of Madatya presented with the reduced sleep, tremors in both the hand associated with the visual hallucination and the anger outburst. Initially they taken their treatment in the different hospitals, and after that they came to us and just given with the Shiropichu with the Brahmi Gruta and tablet the Methyavati capsule alert the 1 BD after food, and tablet the Nirosil 1 TID before food, and the Srikandasava. Okay, whenever we are planning for the treatment pertaining to the monovikrutis, first you need to highlight about the involvement of the mental factors in our patients and select one drug for that particular the mental the correction of the mental the status of the individuals. The next will be the other associated some the complaints. The person who takes the amadhya, there is an involvement of the presentations of the annava shrotas. For that also plan for some of the drug. Here the Nirosil is planned. Okay, the Nirosil is one the drug which is having the Bhumyamalaki as the main ingredient. And next we have the Shrikandasava. The patients of the Amadatya, there is a chance of the Pitta Dushti also. The Shrikandasava is one such drug which is having the Chandana as the main ingredient. That is also planned in this case, the 10 ml TID after food. Okay, after seeing all these the case studies, the one should even follow for the proper the maintenance of the mental health before the occurrence of their disease. The Charaka the concluded And even the Vagbata also told the secrets to maintain about the good health, that is Nitya Hitahara Vihara Sevi daily समीक्षाकारी विषयेषु आसक्तः दाताः समः सत्यपरः क्षमावान् आप्तोपसेवी भवेच्च अरोगम्. The person who is having the good practice of the regularity about the following of the wholesome the diet as well as the lifestyle, and without the much involvement in the disturbance or the minor in the form of the akrodha bhaya without indulging in these and without committing the prajnaprada, definitely they can maintain the good the health. Finally, to conclude about the mental health and even the prevention of the other disorders too, Charaka has given the Tyagaha Prajnaparadhanam Indriyopashamah Smritihi Deshakala Atma Vijnanam Sadrutasya Anuvartanam. First, one try to avoid the committing of the intellectual the errors and try to control over their indriyas and have the proper the knowledge about the desha kala and the self, their atma refers to the individuals their own, and vijnana also a shastra jnana, and following of the sadruta in their day to day practice, then one can maintain the very good health. With this I conclude my presentation.
Thank you, sir. Any
Yes, madam.
queries? There are no queries, sir. It was a nice
Yes,
presentation, sir. It was. I request Dr. Ashwini Patil, ma'am, Associate Professor, Department of Panchakarma, to give you the vote of thanks.
Thank you, sir, for your presentation. I wish to express my deepest gratitude to our guest lecturer, guest speaker, and a successful Ayurvedic physician, Dr. Shiddanagouda, sir, for enhancing our knowledge and helping us to understand various aspects of psychological disorders. Special thanks to our enthusiastic delegates for their active participation and all Ayurveda colleges for motivating their students and staff to join this event, without whom this session would be not successful. It feels immense pleasure to thank our founder member, Sri S.B. Ghatke sir, and a source of energy, Chairman Sir Mr. Amit Ghatke sir, and Managing Director Dr. Mansi ma'am for their encouraging guidance and support. We also thank our Principal Dr. S.B. Gadihalli Shetty sir, Organizing Secretary and Vice Principal Dr. Adevesh Arkeri sir, and Event Coordinator and staff members of KayachikitsaS and Panchakarma Department. And finally, I would like to thank technical team, Dr. Vishal Banti, Mr. Rishi, Sandeep, all the teaching and non-teaching staff of hospital and college. Once again, I thank all the delegates who have graced the lecture and made it a grand success. I would like to end up by saying that you cannot control everything, and sometimes you just need to have faith that things will work out. Let go a little and just let life happen. Thank you.
once again, I would like to thank our beloved principal, Dr. C.N. Gowder sir, and our management, all the students and faculty of our college. And also, I would like to thank Dr. S.V. Gaddehalli Shetty sir, and my friend and vice principal, Dr. Advesh Arikiri sir, and all the technical team and students of SBJ Ayurvedic Medical College. Thank you, one and all. Thank you, madam.
Thank you, sir.